Right, okay. I'd like to spend a few minutes talking about prehab. This is a term that I use with a lot of my clients, especially my sports-specific clients. Prehab is basically a stage where people are training, in high-level, high-intensity training, who are training for obviously sports performance enhancement, but also training to actually not sustain any kind of sports-related injury. Now, obviously, injuries happen; it's just a fact of life. But obviously, we'd like to get to a stage where our body is strong enough not to sustain any kind of sports-related injury, because obviously, all injuries, all they do is put us back, and then obviously require a lot more work to actually get to the top level of sports performance. So they're a bit of a hindrance really to sports performance injuries, and they're not very nice, can be very frustrating as well. Rehabilitation is working with any kind of sport, doesn't matter what sport you take part in, but making sure the body is strong as a whole, so there's no weaknesses or any strength deficiencies throughout the posture. So any kind of injuries can set in, especially with lower back injuries, shoulder injuries. I work with a lot of tennis players, golf players, and rugby players who are all who have had previous injuries. So they already have areas of weakness in their posture. So for example, a back injury, it could be a recurrent back injury. Now obviously this is a known weakness, so as part of a postural program, I will design that individual a tailor-made program specifically related to strengthening that injury that he or she has had in the past few years, because obviously it's a known weakness. So it's an area of concern, it's an area that we really focus on to strengthen up, so in terms of rehabilitation, so no other further injury will occur through that lower part of the body, through the back or the shoulder or wherever it may be. This is related to any kind of sport. So example, golfers could have maybe a previous hip injury through rotation of the hips. This is an area then I would go back to the drawing board, design the tailor-made program for that person, specifically working on enhancing the strength and conditioning through the hips. So in the future on down the line, a year down the line, 6 months down the line, he or she won't have any kind of performance-related injuries through the hips, and should hopefully then prolong that person playing top-level sport for quite a few years to come. Flexibility, muscle conditioning, power, speed, endurance, explosive lifting. This is all major part of the program. Now obviously, being a sports-specific athlete, I will tailor-make the program directly to what sport you perform. If you're a non-sport specific athlete, then obviously if your aim in life is to go walking every weekend in the hills or in the Malverns or wherever you go walking in rough terrain, then obviously I would direct the program working directly towards your specific desired goals. But sports performance, flexibility, huge part of the program, very important part of the program in everyday life really. Flexibility, power output, speed enhancement. So examples like sport like basketball, tennis, hockey, rugby, football, any kind of sport that involves change direction, moving, quick speed, lateral movement, work, forwards, backwards movements, agility-based work. The program can be directly performed and written to your specific needs. Explosive lifting, so any kind of sport that requires a lot of power output, like example rugby. The program I can design will include Olympic lifting, major Olympic lifting movements, so speed development, explosive power, the legs, also obviously specifically related to rugby, and the actual desired movements and movement patterns that are actually included in a rugby game. So a lot of it will be tailor-made to your specific sport. Rehabilitation. Now, rehabilitation, there's many physicians out there who work with rehabilitation, e.g. Physiotherapists, osteopaths, chiropractors. A lot of people, sport-specific and non-sport-specific, will go and visit one of these physicians for any kind of what we call remodelling of an injury. So, for example, if someone's had an injury on a lower back, say if someone playing badminton, 9 times out of 10 they'll go and see either a physiotherapist, an osteopath, or a chiropractor if it's back-related. What I do as part of a postural alignment program is specific rehabilitation programs. So, for example, if someone came to see me, a tennis player with a shoulder injury, I actually work in conjunction with physiotherapists, osteopaths, chiropractors. So we have a cross-referral system whereby if a badminton player went to see a physio for a shoulder injury, the physio will assess that problem and then say, right, okay, you need to go and do this with that injury. So that person then will come and see me. We work to a postural alignment program, retracting the shoulders. If the shoulder was in balance, we pull that shoulder back down, align the shoulders, retract the shoulders, and work on specific strength and conditioning exercises to stabilise and support that shoulder. So therefore, hopefully, a few months down the line, that person can go away, play badminton again with no injury-related problems. So hopefully, that's the main aim of the program. The whole part of the program is muscle conditioning and muscle control. Okay, so it's a huge part, whether you're sports specific, non-sports specific. Controlling the muscles or muscle conditioning is a very, very imperative part of the program. It's tailor-made to your individual weaknesses. So for example, if you're a hockey player or a rugby player, netball player, and you require explosive movement using the legs, okay, and you find it very, very hard to utilise and use the quadriceps or the glutes, I'll tailor-made design you a program specifically working on what we call firing those muscle groups. Okay, so you're working on actually initiating the muscle groups that are very hard for you to initiate in everyday movements. So I'll actually teach you how to learn how to use those muscles, how to actually individualise and utilise those muscle groups, which you'll find hard to do on your own. Alignment of skeletal structures, for example, a back injury is a common injury, a very, very common injury that I see day in, day out. Lower back injuries are the most common injuries. About 90% of my clients I see have some kind of hip-related, lower back-related injury. Postural alignment training basically is going to align that skeletal structure, so hips, knees, shoulders, ankles, everything's going to be in a nice complete alignment, so hopefully the skeletal structure won't be imbalanced through the structure of the lower back, okay, but just by pulling one side of the hip down so the actual hip bones aligned, okay, that's going to therefore align the upper back and the shoulders, so there's going to be no imbalance for your shoulders, so hopefully therefore no misplacement and no problems with injury related problems with the backs, upper back or lower back or even the hips. Okay, so prehab is obviously the most ideal situation, so obviously no one wants to be injured, no one likes injuries, they find it very frustrating and quite a chore actually in relation to sports performance. But rehabilitation is the best way to go. If you've got any kind of twinge or you've got any kind of suspicion that you're going to have on the onset of an injury, whether it be lower back, knee, ankle, whatever it may be, it's best to get it treated soon. So either go and see a physio, osteopath, chiropractor, or therefore follow this program, and it will actually provide you a lot more support, stabilisation exercises, strength and conditioning exercises. So hopefully, fingers crossed, down the line, you're not going to sustain any kind of performance-related injury at all. If, however, you have sustained an injury, sports performance or non-sports performance related, rehabilitation is an essential part of correcting any kind of muscular injury or skeletal injury even. So rehabilitation is a very unique part of a program. It should be specifically designed by a strength conditioning or a conditioning specialist, designed on focusing on purely on the injured area. So whether it be a shoulder, back, knee, ankle, wrist injury, whatever it may be for whatever sport, the program for a rehabilitation program should be designed on specifically working on strengthening tendons and ligaments around the supporting joint to offer full stabilisation and full movement of that injury. Following this program, the Postural Alignment program with me online will enable you to do that efficiently, easily, and you'll gain some super results.